Hi, this is Cindy Clark from PAC-B TV. I'm here today with Meghan Berry from Onondaga Physical Therapy for an Ask the Expert segment. Welcome, Meghan. Thank you for coming and joining us.
Thank you so much for having me, Cindy. My pleasure to be here. Very excited to chat with you today.
Well, I'm very glad that you are.
Yeah.
Today, we're going to talk a little bit about osteoporosis, which a lot of people I know have osteoporosis, and it can be a potentially life-changing situation. Now, why don't you tell us, what is osteoporosis?
Absolutely. So, as far as definitions go, there are a couple out there, but the one that I like really talks about, just a reduction of the bone mass that you think of, but really also a reduction of the bone quantity and quality, which then makes the bones more fragile and then predisposes them to a fracture, right? So it's essentially a weaker bone. So that is what osteoporosis is, at the core.
Okay, now is it more age-related?
Yeah, there are a few different kinds. Mostly what we think of is age-related. As you get older, definitely think postmenopausal women, Caucasian. That's kind of what you picture in your mind when you hear osteoporosis, but it doesn't matter the age, doesn't matter the gender. There are cases out there of 30-year-olds with osteoporosis. It all depends on, there could be certain other factors at play, any other diseases or anything like that that could cause that. But it's all around us, really, and we don't know about it.
Well, is it something that it affects women more than men typically? Or?
Typically, yes, but definitely men can be affected as well. I've treated several men for osteoporosis over at Onondaga PT where I work. So.
Oh, okay.
Yeah.
Oh, because I'd heard, when you hear osteoporosis, or it's usually from women that you hear about it. Now, all right, going along with the osteoporosis, what's the osteopenia?
So osteopenia, it basically is, it's still a weaker bone, but it's not as weak as osteoporosis. It's kind of like, how there's like diabetic and pre-diabetic, right? That same kind of thing,
right.
Osteopenia, you still have a weak bone, but it's not quite to that level yet to really cause osteoporosis.
Okay, and that's something that you can work with. We'll discuss this as we go, but that's something that you can work with maybe to help prevent going into osteoporosis?
Yes.
Okay.
Yes.
All right. Okay.
So, we always focus on, you hear bone mass, right? Oh, I got a DEXA scan again today, right? Have you ever had a DEXA scan done before?
Just a bone density,
That's a DEXA scan.
Okay,
yep.
Okay, good. All
yep,
right.
So DEXA scan is the technical name for it.
Right.
There you go, learned
okay,
something
good.
new today.
I did. Thank you.
So that's how they classify osteoporosis, right?
Okay.
So they take that bone density test, they get your scores, and they compare it to someone of the same age, or someone of like 30 years old, right? That's what your normal bone density should be. And they compare your density to that density.
Oh, okay.
Right?
Okay.
And then based off of that discrepancy, that's how they classify osteopenia, osteoporosis.
Okay.
Does that make sense? I
Yes,
feel like
it
I
does.
might have went on
Yes.
a little tangent there.
Yeah, no.
Okay.
No, I'm processing.
Absolutely. Process away.
I am. Now, what can one do to improve their bone strength?
Great question.
Thank you.
Question. So one of the biggest things you can do is exercise. Weight-bearing exercise, getting up and moving is one of the biggest things that you can do, right? If you think of our bones kind of like lattice work, right? Like it's, bone is porous, right? It's
Yes.
not completely solid.
Right.
Yes.
Okay.
So in those little pores is bone marrow. And depending on what we do, that's going to change how the bone marrow form, what it does, right? If we just sit there, that bone marrow is going to change into fat, and it's not going to help us at all. If we get up and move, that bone marrow is actually going to be stimulated, and it's going to help you make more bone. It's going to make your bone a little bit stronger, which is what we need to prevent fractures. So,
okay.
So that's why getting up and moving, putting weight through your body, feeling the weight through those joints is going to help you get your bones stronger and prevent any fractures or any breaks.
Okay. So the marrow is very critical here.
Absolutely.
All right. Okay.
Yeah.
All right. Now, we talked a little bit earlier about the Meeks Method.
Yes.
Okay, now tell us about that.
I'd love to. So the Meeks Method, it was developed by Sarah Meeks. She's a physical therapist based out of Gainesville, Florida. This was developed back in, I want to say late 80s, early 90s, and she was working with patients in the hospital who had compression fractures and osteoporosis. And at the time, it was like, good luck, figure it out. What are you supposed to do? So she had no idea, so she kind of, did some research, figured things out, and she started to develop this postural correction program for people who have osteoporosis to focus on getting their spine in what's called optimal alignment, to feel better and to not focus on going into these extremes, right? Going into like all these back bends or forward bends, just focusing on what feels comfortable and what is safe for you to do. Mm-hmm. That's what the Meeks Method is about. So like I said, it's a postural correction program. It's a 12-step program, basically. It's the Meeks Method. It has what's called a wheel, and there are different points that go off of it that are the principles that I use and any other therapist would use to guide your treatment moving forward, right? So when you come in, you do a detailed evaluation, you take pictures of your posture, we take measurements, see where everything's at, and then based off of those measurements, we determine a program for you for how to make your posture better and your bones a little bit stronger. So
now, does everybody have to do 12 steps, or is it just there are only certain steps that apply to certain people based on your condition?
You got it.
Okay.
Yep. So I can kind of like pick and choose. So, some people I have to work on and stretch a little bit more than others.
Okay.
Right? Some people, their posture might look pretty good, but they just want to work on preventing a break moving forward. Okay, so maybe with that person, we're not going to do stretching as much, but maybe we'd work on balance or do something like that, right? So we can kind of tailor the program based on what your needs are.
Oh.
That makes sense?
Yes, it does.
Yeah. Okay.
Yeah, it does. It does. All right, well, then when you're talking about the steps that you have to do with this Meeks Method, now what types of exercises do you recommend are there any types of exercises that you recommend more than others? Let's put it that way.
Absolutely.
Okay.
So there is one exercise, I put a hard stop on for people with osteoporosis or osteopenia, and that's anything with repeated bending, sit-ups, crunches, flexion-based exercises like that put our spine at the greatest risk for a compression fracture.
Now that's sit-ups?
Sit-ups.
Okay.
Yep, sit-ups, or sitting with maybe not great posture, which I could be doing right now. I'm going to sit up a little bit straighter.
I can see you looking at me because my posture's probably not all that good today.
That's okay. That's all right. Anything like that rounds the lower back, that's what we want to avoid because that puts our spine in a very vulnerable position. So what we do is we focus on laying you down first, right? Unloading the spine. When you lay on your back with your feet up, your spine is unloaded by 65%, right? If you're...
Oh.
Yeah.
I didn't know that.
Yeah. Wow. There you go, number 2 for you.
Okay, we'll sit up here
right.
now.
So
okay.
if you were to stand, right, you'd say standing, that's 100% of load on the spine.
Okay.
Laying down unloads it by 65%. And I want to say, I will have to double check on this number for you, but I know that sitting with poor posture is somewhere around 200% of the force on your spine. Oof. Right? So even just those little changes we want to be really mindful of, as much as we always think, oh yeah, I got to keep my posture up. It really does matter. So we focus on laying you down, working on exercises on your back in a pain-free way, so that you're not worried about trying to stay upright, trying to keep good posture. You can just focus on isolating those muscles that you really need to hit. And then as they get stronger, we can gradually work against more gravity. And then we progress through there.
Okay, now what about, like exercise? You said earlier the exercise is so important.
Yes.
Now, outside of if somebody comes into your business,
yeah,
what about like dance or Zumba or something like that? I mean, is that...
Oh, I love that. That's great. Especially because it's not really predictable movement. Our body begins to expect patterns and, know where we're going to move, and it learns how to respond to that different pattern or that movement pattern that you do. When you change up your movements and maybe step a little different or do something differently. You stress muscles in a new way, and you make them stronger in that way versus the same exact thing each time. So anything where you're moving around, you might be doing different moves, like you said, Zumba, something like that. Or honestly, even just walking outside, walking at Beaver Lake, love it. Because you're stepping over the roots, you're going over the nooks and crannies. Granted, you have to be careful. Watch your ankles.
Watching those nooks and crannies.
Yes, maybe carry a walking stick.
Right.
That's fine. Safety is the number one priority with any exercise here. The biggest goal with the Meeks Method is to prevent the next fracture or prevent a fracture from happening. So that is my big piece of advice with any exercise.
Well, the non-repetitive. That is more beneficial than just the same thing every day.
Exactly.
Okay.
Switch it up.
Yeah, that's right.
Yeah, or
get
maybe
out of the loop a little bit.
Right, or maybe say you love Zumba. Well, instead of doing Zumba every day, let's do that 3 times a week and do something else on the other 2
something
days.
say for your core or something like that.
Exactly.
Okay.
Yes.
Okay. Now, what about like planking or something like that? Is that good
Perfect.
or bad? Okay.
I love planks.
Now I got to tell my instructor it is okay for
I
us to do
know.
it because I said, well, maybe it's not. Well.
Yeah.
Oh well.
Anything that your spine is straight and stays like in good alignment, love that. If like a sit up, you're laying on your back and then you're curling up, doing things like that. You're flexing that spine. Anything that you stay straight the whole time, love that because that's a foolproof way. You're like, all right, I know I'm doing everything right. I'm not going to hurt anything. Safe to do.
Okay. Good.
So,
well, if you had to give some pieces of advice to people as far as to help prevent osteoporosis or osteopenia, what pieces of advice would you give? I guess it doesn't matter if you're 30 or if you're 60. You tell us what you think. What's the best thing you can do for yourself to help prevent that or keep it from getting worse?
absolutely. The biggest piece of advice I would give is the earlier the start, the better, right? But it's not too late to start. You're like, oh man, if I knew how important my posture was and my core was 20 years ago, maybe I wouldn't have osteoporosis or do something like that. Maybe. Right? But we can play that what if game all day.
I guess you can.
Right, and
yes,
that's not going to help you in the long run. So instead, focus on getting out and doing something now, right? And do something that works for you. Maybe in your mind you're thinking, okay, I got to work out, I got to go on the treadmill, I got to walk for a half hour. I know that's what I'm supposed to do. Let me get out there and do it. But with this wonderful pandemic that's been going on, our lifestyles have changed a little bit. We might not be as active as we were before or really have all that stamina. That's okay. You may be able to get out and only go on the treadmill for 5 minutes. That's okay. Do what you can and then try and do a little bit more the next day. Don't focus on what you can't do. Focus more on what you can do.
Good advice.
Exactly, and find something for you.
I know a lot of people get intimidated, going to the gym. Oh, God, I got to get up. I got to go to the gym. I'm tired. But if you keep pushing yourself to get out, not just the gym, but any type of exercise, if you can it's a mind over matter type thing, or get a buddy. That's what I found works very, very well.
Absolutely.
And the old statement, if you don't use it, you lose it. And you really do. I've seen it happen. I'm a senior, and I've seen it happen with a lot of friends of mine where they just give up. They just give up. They go, oh, I can't do that. Or, yeah, you can.
Right.
Yeah, you can.
Yeah.
You put your mind to it, you can. Because if you see the results, the positive results of exercise and whatever versus no exercise, that should be enough.
That's
that
a
should be
no-brainer.
enough. It
Right.
is a complete no-brainer. You're absolutely right.
Exactly.
You're absolutely right.
Yeah.
Well, I'm thanking you for coming here. That was very nice. I appreciate it.
Well, thank
I've
you so
learned
much.
so much today. I really have. And
Well,
it's good
good.
to know. It's good to know because, like I said, we have a large senior population in this community, and I hope that they all watch this because it's very informative.
Absolutely.
And if anybody has any questions, you can contact us at www.PAC-BTV.org, and we'll make sure that we forward the questions to Meghan. But again,
Absolutely.
Thank you again for coming. I appreciate it.
Absolutely. It was a
Okay.
pleasure to be here.
All right. Thank you.
All right. Thanks.
Thanks.